Warm welcome. Today we are here with Professor Ilona Kickbusch, a leading expert in global health policy and diplomacy. Welcome, Ilona.
Thank you very much.
Ilona is the founding director of the Global Health Program at the Graduate Institute in Geneva and has played a key role in shaping international health strategies and initiatives. Today we are here as we are discussing a session that took place in the 2025 European Health Campaign Forum that focused on a new era for geopolitics, and it focused on what implications for a more ambitious European Health Union. The session explored how today's shifting geopolitical landscape is shaping health policy across Europe. Ilona, today you spoke about many of the very complex geopolitical challenges. In this growing complexity of global health and a shifting geopolitical landscape, as well as an increasingly political and divisive nature of health, what do you see as the most concerning geopolitical challenges to global health today?
That's a big question, and there are many of them, of course. I think I'd like to reiterate one thing that you said, and that is, in the past, in global health, we felt very strongly that health unites us. That countries might have a lot of problems with each other, they might have different ideologies, they might be in the global north or in the global south, but together, jointly, we would try to solve health issues. What we see now is that health actually divides us, and that is due to geopolitical developments. It's also partly an outcome of the experiences with COVID-19, because the developing countries, the global south, felt that the global north had failed them, that this consensus, this solidarity that was supposedly there in global health did not work. One of the issues is, of course, vaccine nationalism, and we still feel that as we negotiate around finalizing the pandemic treaty, the annex that is so important. Then, of course, you have the response of some of the most powerful countries in the world, that they are no longer committed to multilateralism and to the rule of law. And that, of course, is very much related to health, not only in terms of the impact of war, but also in terms of health as a human right. And within that context, the lack of commitment to the World Health Organization, for example, and the announcement of President Trump that he would leave the organization is another big factor that, of course, has weakened the organization considerably. And therefore, you sort of say, well, where is a normative organization that will continue to set rules, to speak out for health as a human right and everything that comes with it? And one of the consequences also of this whole development is a lack of commitment to development aid. You will know that many countries in the global north have significantly reduced their development aid for health. And of course, the United States to a very significant amount. Many major programs have had to be stopped. And at the same time, nobody at this point is replacing this money. Because if you look at the European Union, which did replace some of this during the COVID times in the first Trump era, it is now faced with financing the Ukraine war. So you can see that these tensions impact in many different ways. They influence each other. There's a whole new dynamic, and that dynamic is finally reinforced that health has become such an important not only geopolitical factor, but let me say geo-economic factor. It's part of security considerations, it's part of a tech race, it's a race for innovation that turns into economic profit. And so what we also see is where one used to work together in science, in research, that now again countries are sort of holding back because my research will help my tech company, my pharmaceutical company, and we want to be sure we have this market. So it's a totally new ballgame. In global health, it needs totally new strategies from international organizations, from NGOs, even from the industry. And I think we must spend much more time thinking about that, analyzing this enormous competition around health, and finding solutions for that. And nobody can find them alone. So in a strange way, as the world is fractured, public health people, global health people are pushed in a new way to work together, because nobody will be able to resolve this alone.
Wow, you've mentioned many challenges, from financial, institutional, some lack of trust. So in this complex, challenging area, we also want to discuss the opportunities. What opportunities do you think exist for the global health community and the global health organizations across the globe to actually make a meaningful impact?
Well, they have to go back over the books, as we say. Global health organizations and the global health community had got used to a certain kind of global health system. It was a system which was very strongly run by development aid. Every year that development aid increased, we had more organizations, we had more programs, we were able to save more people. I mean, just think of the fact when in the year 2000 Bill Gates and his foundation entered the global health world, what a difference that made when big trusts like the Wellcome Trust started to be active in global health. So the global health world was awash with money. And because it was getting so rich, you look at those statistics and they go up like this. There was not enough questioning of what we do. There was a lot of competition, there was not enough coordination. And so I think basically we have to invent, we have to create a new global health system. Some of that will mean moving back. The question is, should the World Health Organization again focus on its normative function rather than doing all the other things it has been doing? Should it even more strongly be a guardian of health as a human right? Should it be a coordinator in a way of its member states, bringing them together? Meetings at WHO also before the COVID days used to be very much driven by consensus. We see now such consensus is practically impossible. And therefore global health diplomacy has become so important. Not because everyone has to agree, but because you need a venue and you need a mechanism even to air your differences. And you saw that also at the UN General Assembly. So we need to sort of analyze very clearly what should a global health system be doing, how should it be financed, who is responsible, and it's no longer only the global north. And I think it's very interesting that many countries of the global south have come together. There's been a new meeting in Accra where the African countries have said, we will define, finance and structure our own health systems and we will work together. We no longer want a development aid run global health. You can see it in the G20 meetings, which for the last 4 or 5 meetings have been chaired by countries from the global south, Indonesia, Brazil, now it's South Africa, India, and they have set totally new agendas. And these countries are very optimistic, they're developing, they're moving forward, and they're trying to say, how do we support each other? And how then do we support those weaker than us? How does India support Sri Lanka and Nepal, for example? So we see many more of these regional organizations. And finally, we do see some positioning that's also, slightly more political, let me put it that way, because, there's this construct of the BRICS. And they're very different countries, from Russia to Brazil. I mean, here's a democracy, here is an autocrat, a dictator even. And but in this context, they are trying to work together in a way a little bit as an anti-West, and to say we want to set the agenda. And you can see the last 3-4 BRICS meetings or the Shanghai Cooperation Initiative, they all are doing more and more and more on health. And so funnily enough, or strangely enough, they are starting to build new parallel systems that they want to run. And so this power shift between the global north and the global south is massive, and nobody quite knows how it will play out, because China is taking a very restrained backseat, and I think is watching how things are developing, but is very active in the BRICS, in Shanghai, in Africa. And maybe as a last sentence here, one of the big things that will define the future of global health is technological development, is artificial intelligence, and who is building the digital infrastructure in Africa? It's China. So who is exerting pressure on Europe? It's American technology companies. And with health data being one of the most valuable things in the world, we are going to see this as a major component of global health. Who will own health data? Who will make profit? And are we able to create new rules in terms of technology and global health?
Oh, thank you, Ilona. Thank you so much. Very inspiring. One last question from our side. Ilona, you have had a prominent career in global health. And as a woman leader in global health, what message do you want to share with other women working in global health around the globe and also struggling in this complex geopolitical era?
Well, it's not an easy situation for women, because my generation at one stage felt, we're moving forward. But we can see there is a real rollback, and the rollback is both in how global health deals with women's issues. We have great ideological problems around, sexual and reproductive health and rights. We can see that women do not have the opportunities that for a while we were able to fight for. And so I think to some extent it means that women have got to come together again to support each other, and also to remember that yes, we need women in senior positions like the organization Women in Global Health is fighting for. But the really major thing is, if we're in health, we always have to ask, what are we doing for the most vulnerable women? Whatever kind of projects we are running, are we considering the most vulnerable? And also, for those of us who are in the business for longer, are we supporting young women the way that we should? And I think it is the support structure, as one of my colleagues has said, the solidarity infrastructure that we need to build and that we need to guarantee.
Ilona, do you have one last takeaway, one last call to action that you would like to share with policymakers or health professionals that might be watching us today?
Well, I think it is, be clear about your values, stand up for your values, speak out, and don't go it alone, go it together with others.
Thank you very much, Ilona.
Thank you.
It's been fantastic. Thank you.